This project's actually part of a program of work that we've been doing over several years, a big team of us, looking broadly at the role of business in promoting a culture of health and improving the health and well-being of local communities.
We were exploring this secondary line of inquiry about smaller, locally owned businesses and the ways that their actions in the community might benefit health and well-being differently than larger businesses.
I became part of the small business team and spent a lot of time looking at local businesses in Roxbury and understanding how they contribute in so many ways to health and well-being.
Nubian Square is the epicenter of Black culture since the 1960s, and so for African Americans, it's been like the shopping district. Basically, people, of color did all their shopping here in Dudley Square, Nubian Square.
We have a very broad interpretation of the phrase health and well-being. It can actually be your physical health, but it can also be your mental health, your financial health, and how all of those sort of intersect with each other. And so some ways that a business can improve the health and well-being of a community is by providing services or products that reflect the diversity of the community.
When we have small children come in or youth come in and they look at all the books and they see all the beautiful brown faces, it just lights us up and it just really cements this is why we're here.
We have African food, we have Spanish food, you got Mexican, so you attract all type of people. It's for everybody.
We are providing foods that match the needs and the wants of our community. People can come in here and ask for certain things or find the foods that they want and know that if it isn't here right now, we're going to try to find it.
Now what makes me want to come to work every day? I have great bosses. I have a lot of friends. It's just the love, the love.
From an occupational health perspective, makes it a lot easier to get up and go to work every day and be excited about it and come home and be happy and healthy.
The business owners were motivated because what they wanted to encourage was a vibrant local business community, but also a thriving community more broadly. And often that was partly why they had chosen to actually set up a business, because they wanted to be able to make those kinds of contributions.
We on the public health side are really just not taking advantage of this incredible asset that sits in communities. This is already there, and folks are being really thoughtful about how they're going to advance their community. How can we as public health folks be a part of that and a complement and a support to the work that they're already leading?